My name is Zinka. I am 47 years of age, and I had laparoscopic gastric sleeve surgery, which was performed by Mr. Ahmed in January of 2022. I would almost start from present. So I'm just over 3 months post-op. And I mentioned several times in my feedback and discussion with my friends and family that my life has truly transformed, I feel, in terms of how obesity has affected me before. I was morbidly obese, so my body mass index, as it's calculated, was, I believe, 43. And I certainly, although I didn't have any diagnosed conditions like diabetes, I was really heading along that trajectory. So I had lots of fatigue, so I would be constantly tired. It was these symptoms and difficulty that I was experiencing in my everyday life, bending, squatting, walking up the hill. I would be short of breath and I wouldn't be able to keep up even with my 10-year-old daughter when we go and walk. I have two dogs. So it was really obvious to me that I was struggling with my activities of daily living. So I think I have come to the point at the age of 47 where I realized that I can't actually embark on another diet. And I was reading, before I ever even started researching about Mr. Ahmed, his team, and a particular route of his bariatric surgery, I was just probably spending a good few months just researching a lot about different bariatric surgery types. So once when I decided to contact him for advice, I wish I'd done it before, that's really where everything slotted into place. He was instantly really reassuring, and looking at just his profile, reading testimonials, this is why I decided to come forward and do testimonial. It was really, really helpful because I think that was a big part, apart from sort of identifying the right consultant. It was looking at the testimonials of those patients like myself that have gone through this. And he was so patient and understanding. He would always, first of all, he would understand my worries and concerns. And he would always answer it, make sure that I was reassured if I had any further questions. He always had time. He was never really in a rush and wanted to make sure that I'm okay, which I felt with every sort of interaction that we had. One thing that I didn't expect is how much I'm going to enjoy this process of losing weight. And that's actually what's happening. I'm really enjoying being lighter, not waking up with feeling that my joints are hurting, not feeling fatigue. I'm absolutely full of energy. I would come from work now and I would walk for an hour. I do an hour walk now. So my blood pressure has normalized. And it was all obesity related. I have lost 4.5 stones. Looking back on this whole process from pre-surgery, during the surgery, and now enjoying this process, I really look at it with so much really gratitude, first of all, and I feel I was so lucky to have, first of all, identified and found Mr. Ahmed as my surgeon, and I enjoy sharing my stories, supporting a lot of my friends, family, and colleagues that are potentially going through the same struggle. The only tips I would give to others who are thinking about bariatric surgery is not to delay that contact with the consultant, because I think that was really important, is to make that appointment, ask the questions, and not hesitate. I think just and do your own research, obviously, as I have.